Okay, let's go ahead and get started. Thank you for joining us today. My name is Becky Ofran from the City Health Dashboard. We are a project of NYU School of Medicine, Department of Population Health, and supported by the Robert Wood Johnson Foundation. Today, for our virtual office hours, we are talking about communicating and visualizing public health data. Just noting that me in particular, am not the expert on this exact topic, but we do a lot of this at the City Health Dashboard. And we also talk with a lot of you who are doing this on a daily basis as well at local public health departments, advocacy groups, and other organizations. So as we get started here, if you could just put into the chat your city or organization, so we have a sense of where you're coming from today and your current top issue or concern as it relates to health data communication. And as we get to the end or throughout the presentation, really feel free to chime in the chat with questions or other resources or examples that you have of good and poor data communication. We'll have an opportunity to talk about that, and I hope that we can have a great discussion today. We usually keep these virtual office hours pretty small. It's usually just a monthly way to check in with new or seasoned users of the City Health Dashboard and get into questions and issues, but there was a lot of interest in this topic today. So we have a little bit more people than usual. So if it's helpful, you can just put it on speaker mode, but we are recording this if you need to hop off or if you want to share it with colleagues later on. So we'll share the recording after today's session as well. So let's dive in. If you're not familiar with the City Health Dashboard, our goal is really to help cities across the US leverage the power of data to improve the health and well-being of everyone in their community. And communicating data is a big part of that work. And we do that work by providing 40 measures now of health, the factors that shape health, and the drivers of health equity to guide local solutions and policymaking for over 750 US cities. The site is free to access at cityhealthdashboard.com, and the data is also accessible by download or API through the site, as well as the visualizations on the site so that you can use the data in other ways. And I'll get more into the dashboard and why data communication is important to us later and how we've had that kind of shape our use of the data. But first, we'll review some data communication principles and examples. So a lot of what I'm sharing today are examples from the book, Making Data Talk, and you can see the information on the book here. And while the book is a great resource for practical go-to tips, I highly recommend this linked workbook based on the book. And it's freely available as a PDF through the National Cancer Institute. And we'll share the link in the chat at some point, but know that there is a lot that we could cover on this topic. It could fill a week-long webinar or a whole graduate course, really. So I've tried to summarize the top issues to consider when developing messaging based on data and really geared towards public health practitioners. But I highly recommend looking at the workbook here or the full book itself if that interests you for a lot more detail on these topics. So first, when thinking about communicating public health data, you really need to consider the audience you want to reach. And you might say, I want to reach everyone. You know, my data and what I'm trying to share is so important, but you really need to get more specific than that. Who is it you're really aiming to reach, and what do you want them to do with this information? So public health audiences most often targeted include the public or a subset of the public, like a specific community in your city, policymakers, or the press. And that's what this book and these examples will focus on today, are those three main audiences. And when sharing scientific data, your audience wants to know why they should believe what's being recommended or shared with them. They want to be given the rationale for how the scientists or health officials reached those conclusions, and they want to know what to do with the information they've received. And as I was putting this together and really thinking about this work, of course, COVID is top of mind. And I'm sure it is for all of you as well. So you'll see in some of these examples how audiences might be taking this information in different ways. And we can get into more of that in the discussion later. But the topic broadly does not apply just to COVID. So here are some really helpful tips for presenting audience-friendly data. And I won't read through all of this, but this will sound familiar to some of you. So avoiding terms that aren't frequently used outside of the scientific community, such as cohort and longitudinal. I know that sometimes we want to really specify exactly what we mean and how we got to our our outcomes or whatever data that we're sharing, but trying to really think of it from a more general audience is important. Also avoiding terms with multiple meanings. Surveillance is a big one. We think of public health surveillance, but that surveillance means something very different to a general audience. So, again, it's a trade-off between being really specific about what we mean, but being really understandable as well. Some science and math concepts that can be frequently misunderstood include things like proportions, relative risk, percentage increase versus percentage point increase. So really thinking about how you share that information is important. And then focusing on the main message instead of the detailed scientific arguments or outcomes. As the people kind of creating data or pulling state data that you're trying to share to a local audience, really trying to get to what is the key message I'm trying to share here. There's different reasons we share data, and we'll get into that in a little bit, but really trying to think about that main message is important. And then just touching on the different audiences and what the impact of what you're sharing in your data and what the message is for the specific audience that you're trying to target, or other audiences that might be accessing this information, how they might read that impact is important to consider. And then some other important things to consider in public health language is how you refer to specific communities. If you're trying to highlight information about non-English speakers, specify that and try not to generalize it as vulnerable communities or immigrant community. Really say what you mean, and also consider how your description of specific communities lands for those individuals. And the best way to do this is to actually talk with and incorporate these opinions and feedback into your messaging. And there are some great resources from communicatehealth.com, and I'm sure plenty of other places. So if you know of some other great resources, please feel free to share those as well in the chat. But communicatehealth.com has a lot of great blogs and really short pieces, including this one here about kind of retiring the term vulnerable communities and really trying to get specific about how the community has been disproportionately impacted or affected by a specific issue. I know this makes the language sometimes clunkier and longer, and so far I've been telling you to really zero in on your message, and we'll be talking about using less words, but sometimes more words in the communication is important so that we're not just using kind of generalized language that doesn't really explain the impact that we're trying to explain. So you also need to consider the purpose of the communication. So kind of the four main purposes that probably come up in public health communication the most are increasing knowledge, instructing people about a specific issue, facilitating informed decision-making, which is a lot of what we do at the City Health Dashboard, and persuading your audience to take a specific action. And many of you may have heard of the push-pull method of communication, but there's really different ways for people to access and get information and communication. So pushing messages is active. It means sending messages to audiences through mass media campaigns, social media, emails, newsletters, things like that. And then the pull method is more passive. That's posting information on a website so that information-seeking audiences can find what they need to know. And it's important to consider both of these in your communication so that if it's posted on your website somewhere, that same messaging can then be used in your push methods so that your audiences can be getting it from multiple places. And then just kind of a running list here of some other best practices to consider. One is, should data even be presented, or can the message just be done with words? There's often a desire to share data because we have it. But sometimes if you're really trying to zero in on a single important message that you want your audience to know, consider, does the data even need to be presented, or can I just use it for my analysis to gain insights and then share that final messaging? You want to just present the bottom line, and then just whatever really necessary data points are needed to support that bottom line messaging. And then in terms of uncertainty, people will notice if something obvious is being left out of the message. And instead of asking the questions back to you, especially if there isn't an easy way to communicate back and forth, they will often just write off the whole message. So it's important to address uncertainty directly. When you're creating visualizations based on the data, really ensuring that it's usable. And that means, including a small box that really highlights the key points, or an upfront short text summary before the data visualization. And then choosing familiar data formats for your audience. So if you're sharing data that, for example, is almost always shown as a trend line with data by years, don't try and get too fancy and change it up. Try and keep it familiar so people's brains can process it quickly. And there's, ways to make the data look good, and we'll get into some of that. But if it's a familiar format, try and keep to that. You want to minimize clutter, but use verbal qualifiers when helpful, such as it's low risk or most of the time. And again, I know for our epidemiologists and data folks that this might be uncomfortable because you really want to be specific. But again, keep in mind those different audiences, and there's a time and a place for the specifics and a time and a place for really just making the message as brief as possible. And then in terms of metaphors, it can be really helpful for people to see the numbers as something familiar to them, like one seat in the stadium is the level of risk that we're talking about, or the number of people in your town, or something like that. Just to make it really approachable by your audience. The workbook and the book get into some great examples of some best practices around data and visual symbols, and I just wanted to share one here today. So pie charts, we see a lot of pie charts, we use them all the time. And some basics here are that it's meant to show proportions and percentages, especially for comparison within a total of 100%. And it's good for highlighting the largest and smallest pieces of something. Some things to keep in mind in terms of pie charts is making sure that the largest slice is pointed at 12 o'clock, so the yellow one here. And then you display the slices clockwise in descending order. Using short labels that just go off horizontally to the side next to each portion, and really trying to separate them so that you can see them clearly. And then not to show more than 6 slices is kind of a standard guideline. So let's practice this. Your turn. How might you modify this pie chart to make it more effective, or what is working well in it? And I'll just pause a second so you can look through and practice what you just learned, or perhaps other things you know about pie charts and displaying data. And I'll open up my chat here real quick just to see. Yeah, so using percentages. Feel free to pop into the chat any other suggestions. Yep, placing in descending order. So they have the pieces kind of in different places. And we know that kind of going in clockwise order with the biggest chunk on the top is best. Great, some great suggestions here. total over years or average. Yep. Putting the takeaway message in the title. Yeah, more variation in color. Great. Great, you guys are pros. So yeah, so placing those slices in descending order, beginning at 12 o'clock, going clockwise. Trying not to stack the labels. This is getting a little kind of jumbled over here, and it's hard. And I know sometimes when the slivers get small, it can be harder, but sometimes using the line going off to space that out a little bit can be better so they're not stacked. For COPD over here, kind of a trade-off, again, depending on your audience. If everybody will know what COPD is because you're only dealing with a medical audience, perhaps, then you can abbreviate that since it is kind of long, but otherwise leaving it out with the full title is helpful. Maybe changing the title here to specify number of yearly deaths caused by cigarette smoking by disease, since that's really what it's showing. Coding it with metadata that can help people use assistive software, great point. Yeah, and more common language for the labels potentially, again, really depending on that audience. Great. So again, there's some great examples and exercises in the workbook, which I hope you check out, but just to give you an idea here of some really practical ways to make some improvements there. So now we're going to go through a little bit more of data visualization, and these examples that I'm going to share mostly from Burness Communications, who we work with at the dashboard. They're a communications firm that are really great at helping get the message across. So here we're looking at just the data. A lot of people think that data can speak for themselves. So here are a couple of charts just showing some interesting data. And if you have a minute or two to look at this, maybe you're scrolling through social media and this pops up, does this tell you a story? It's a little hard to differentiate that. You know, would this catch your attention? And if it did, would you bother to figure out what it's trying to say? The answer for most people is probably not. Our attention spans are notoriously short in a world where everyone wants our eyeballs on their content. And we can only take in and process so much information at any given time. And this is called cognitive load, and it refers to how much your working memory, it takes for your brain to process something being presented to you. And our working memory is a limited resource. And so the more we can ease the cognitive load by removing things that aren't relevant or replacing them with things that are easier to process, like visual cues and shortcuts, the more likely it is that our audience will digest our message and understand our key takeaway. So with any good piece of communication, we should be clear and concise in telling our audience what we want them to understand. So let's try to translate these data. Okay, so this is a subset of the same information. We've stripped down our data into a chart to show only the most critical information. And the key message is that we have a lot less workers now in the public health workforce than we did last time we faced an outbreak. And here we're really spelling it out for the audience. We've added some color and design flair to help emphasize certain parts of the chart. And on its own, though, the viewer would still be far more likely to get the point here than with trying to break down the data in these that's presented here. So yes, we're leaving some things out, but again, depending on your audience and the message that you're really trying to get across, this format is much more effective. Okay, let's look at another example. Now, here's a chart that also might be somewhat familiar. You've probably seen something similar at a conference or a webinar related to climate change or natural disasters. So a lot of time and care went into designing this beautiful chart. But as you can see, this simple bar chart got really complicated. There's a lot going on here. What is the main takeaway? What is the message? It would take a few minutes to digest everything that's laid out here. Instead of translating raw data into a visualization like we just did in the last example, let's see how we can redesign this visualization to translate the message that needs to get across. So how's this? We pared down the information overload quite a bit, and now you can start to see a trend line. We also reflected that in the way we titled the graph, just simplifying there. And we're doing the work again for the viewer. We're delivering the message. This is a good example of don't show all the interesting data just because you have it. It really needs to support your message and storyline. This is definitely easier to understand, but I think we can even do a little bit better here. So what's the one thing you want the audience to walk away with? Let's say it's this point about year 2010. It set a record for the highest number of dangerous natural disasters. So here's how we can pull that data point out and make it easier on the audience to interpret. This will stick out to them and be much more memorable. So pair this data graph with a story about a person impacted by the Nashville flood of 2010, and you've got a really memorable message. So here's another example using maps and data from the City Health Dashboard. Across the dashboard, we tend to use Choropleth maps, and these show varying levels or rates of data by census tract. You've definitely seen similar maps by state, for example. And you can merge multiple sources of data to create a narrative. So in this case, it can be a lot to take in, focusing on the variation of every census tract and their relative levels of broadband connection is what we're looking at here in St. Petersburg. So we've highlighted just 2 neighborhoods with their broadband connection rates to highlight how neighborhoods very close to each other can have such different access. And again, we're trying to do some of that brain work for the audience in a visually engaging way. One other geographic example that you could consider, so this is a tile map. It's similar to a Choropleth map, but it removes the geographic size that can skew the data when population data is not relevant to the story. So if you're looking at, does this state or this county have a certain policy or law in this case, the size of the population might not be as important to you as just, is the policy there, yes or no? You may want to show, the size of the population impacted by certain laws or policies. So in that case, you'd want to rethink the tile map, but this can be a good option when you don't always need to know the exact kind of relative size of the population. So a little bit about applying these principles on the dashboard. So for the City Health Dashboard, we have a broad audience from mayors and city managers to local health departments and other city agencies, community organizations, advocacy groups, funders, researchers, and the media. So depending on what message we're trying to get across, we'll narrow down our data use and messaging in a certain way. And just to show you a little bit about how we do that, again, it's, if you haven't used the dashboard, it's just cityhealthdashboard.com. And we've tried to, since we have over 750 cities and 40 measures, we wanted to make it so that the data presentation is similar across cities and metrics. So your brain can do less work as you switch between places and issues. And again, we're not the experts on this, but we did put a lot of thought into how the data is presented on our website. And so you can see we present the really upfront summary. We're looking at children in poverty, the year of data. And then if you want to get more information, there are places to obviously click and get to that. And then as we get into our scale bar, just to zoom into it here. So in this example, we're looking at children in poverty in Richmond, Virginia. So we've provided some basic symbology that carries across the site on different pages, where you can quickly see that this is the value that I'm looking at in Richmond, Virginia for this measure. So 40% of Richmond's children were in poverty in this year of data. And we also provide that as what we call a sense-making statement. Again, just helping the user make sense quickly of the data that they're seeing and put it into a familiar just sentence format so that they can read the data in words. And it's funny, I have a 3rd grader this is so much of what they're learning in math in 3rd grade is, being able to read the numbers out of a sort of sentence-based story. And then some other symbols just showing which direction is better outcomes, since that varies by measure. And again, just carrying that throughout the site. And then sometimes, as you zoom into the census tracts and the map portion of the site, so these values aren't always displayed unless you scroll over when you're on the site, so that you can quickly get just a visual understanding of the relative differences between children in poverty throughout the city of Richmond. So in these census tracts, on the site there, you can see that they're between 0 and almost 94% children in poverty. And as you scroll over the census tracts, these values pop up. So you can start to really zero in on those. And we did that because if we showed all the percentages on the site on every map, it's too overwhelming. So paring that down, but having it accessible to people is helpful. And then one of the other features on the site that where data communication really came into play is our metric comparisons. So we have a way that you can look at two metrics at the same time on a city map. So children in poverty is still the blue choropleth map underneath, and then diabetes rates are overlaid as the pink and red dots, where the lighter colors indicate better outcomes all throughout the site. And again, it's, it might be useful to see the diabetes rates, but that's something that shows up as you scroll over on the site. It pops up so you can see it for each census tract. But being able to show a good amount of information just at first glance while providing that access to deeper information is the way that we've done it on the site there. So lastly, just moving into some helpful resources. These are really practical tools to play with data visualizations and learn more about this aspect of communicating data. So first, the Data Viz project is really fun. It's just a great display of data from a firm, I think, based in Europe somewhere. And they show all of these different types of charts and visualizations so that you can explore them and see when are they most often used. It's just really fun to explore and get some tips and best practices there. Obviously, some of these are more complicated. As you go through the site, you'll see, and not ideal for kind of general audiences, but it can give you a lot of great ideas depending on what kind of data you're using. Another one is Tableau. You're probably familiar with Tableau. It's an analytical and data visualization and mapping tool. But aside from the actual software, they have a lot of great blog resources and learning resources. There's a link that I think we're going to share in the chat. It's an article on some data visualization tips, and it's actually, if you go to tableau.com/learn/articles, it's this one here. That has a lot of great tips on how to visualize different data, some of which we've covered here today too. Flowing Data is another fun resource with some blog and data visualization guides, some courses that you can take, and resources run by Nathan Yao, a data viz expert. And then Data Wrapper is another great tool that you can use, and it's a software, but it's very easy to use. We use it at the dashboard for certain visualizations. You can create maps, and it's very easy to format everything, kind of a low learning bar as opposed to Tableau, which requires a little bit more skill. Of course, there's a lot of other ones out there. And again, please feel free to share them in the chat, or we can discuss them. But these are resources that we kind of turn to and like to explore for thinking about data visualization. So that is the content I wanted to cover today. We would be happy to discuss other examples and resources that you know of, talk about some questions. You can find us almost every month at our virtual office hours. And if you subscribe to our newsletter here or check on our site, we have our events listed, but we cover a different topic each month and are happy to engage with users about the issues that you're dealing with, either with our data or kind of health data, urban data more generally. So I will stop sharing and pause here for any questions. Just trying to scroll through to see if any other great resources were shared too. But feel free to unmute or just pop a question into the chat. Yeah, I see a note in the chat just about from Kristen, our challenge is communicating data in a way that both honors the nuances and limitations and still feels meaningful for our community. And I mean, that's really the big trade-off, it feels like, is that we're all dealing with. It's just, how to show those important nuances, but making it a kind of short, brief, meaningful message is really hard.
And just adding to that note that Becky just read, a way that we've addressed this, because I think this is one of our main tensions at the City Health Dashboard, is presenting information in multiple different places on the dashboard. So we have kind of our most basic level of information on the main pages, but then we also have links, if you want to read, or if you have some simple questions, we have an FAQ. If you want really detailed information about, which census tables we pulled specific measures from and how we do our calculations, we have our technical documents as well. So all of those resources are there, and it's all laid out and spelled out very clearly, but it's not all like the first thing that you access when you're just trying to get that initial piece of information. So that layering can be helpful as well.
Thanks, Shoshana. I also just wanted to point to, I'm sorry, I'm just going back into the chat to see some of the comments from the beginning, that Lindsay from Pueblo, Colorado mentioned concerns around the data collection, and that it might not be collecting information about at-risk populations effectively because of low internet usage. And we've seen this issue with some partners in California about trying to do some survey data collection in communities that don't speak English, and making sure that their voices are captured in this community's health survey. And so, yeah, it's important to kind of zero in on the data collection side also, and make sure that you're considering audience there, and then thinking about it on the other side, then when you're kind of presenting that data, the issues around uncertainty and those missed populations, trying to be clear about that and what that means for the data that you're presenting is important. Great. Well, if there aren't questions, we're happy to kind of stay on the line if anybody wants to wait for it to become a smaller crowd before they ask their question. But I'm glad that we were able to get this in just over a half hour for you. And again, the recording will be shared on our virtual office hours page. And if you have any other questions about accessing dashboard data or want to ever talk health data with us, it's one of our favorite things to do. So thanks for joining today, and we hope to hear from you soon.